Now we're going to talk about the anterior pituitary gland. This is a sagittal section of the brain, and the anterior pituitary is located underneath the hypothalamus at the base of the brain. And if we magnify this picture, we can see that the anterior lobe secretes the following hormones. And these are the hormones that we're going to discuss in this section. The anterior pituitary stimulates the growth of the entire body, and it does this through the secretion of growth hormone. The anterior pituitary stimulates the growth of the thyroid, the adrenal cortex, and the reproductive organs too. The anterior pituitary releases tropic hormones that stimulate endocrine glands to grow and produce hormones that are released into the circulation. Thyroid stimulating hormone stimulates the thyroid to grow. Adrenocorticotropic hormone stimulates the adrenal gland, and reproductive stimulating hormones. The anterior pituitary secretes gonadotropic hormones, including follicle-stimulating hormone and luteinizing hormone. The anterior pituitary also secretes prolactin, which stimulates breast growth. These are covered in the reproductive lectures. So growth hormone has an effect on all body tissues. It affects the growth and development of skeletal muscle and bones. Growth hormone affects protein, fat, and carbohydrate metabolism as well, and it contributes to the height and size of the body. Giantism is a disorder of growth hormone. There is excessive secretion of growth hormone in children, and this excessive growth occurs before the epiphyses close. So the children may grow as tall as 8 feet and weigh more than 300 pounds. These three gentlemen are of the same age, and the one that's standing the tallest is around 8 feet tall, and he has giantism. He's Robert Pershing Waldo. He is the record holder for the world's tallest man. He was actually 8 feet, 11.1 inches tall, weighed 222 pounds. His foot size was 18.5 inches, and he needed to eat approximately 800 calories per day. Acromegaly is another disorder of growth hormone, and it is also excessive secretion of growth hormone, but this is in adults, and usually the onset of this disorder occurs in the age of 30 to 40 years. It's usually caused by a pituitary adenoma. Adenomas are tumors characterized by excessive production. And here we see a picture of a microadenoma, which is about 4 millimeters in size. Here's a macroadenoma, and here we see a giant macroadenoma. And these pituitary adenomas can produce growth hormone. Here's Andre the Giant. Some of you may remember him from the movie The Princess Bride. He had acromegaly, and he had a pituitary adenoma, and he declined to have treatment for his pituitary adenoma. He was 7 feet 4 inches tall and weighed 500 pounds. Andre the Giant eventually died of congestive heart failure. So adenomas, we talked about, are these tumors that are characterized by excessive production. So growth hormone antagonizes the action of insulin. And this excessive growth hormone can cause elevation of blood glucose due to insulin antagonism. And this can cause impaired glucose tolerance. It can also cause polydipsia and polyphagia and hyperglycemia. So excessive growth hormone in acromegaly can also cause overgrowth of the bones and soft tissues, causing arthritis, thick skin, and oily skin. The bones increase in thickness and width, but not length. Remember, because this disorder sets in after the epiphyses have already closed. So the bones can no longer grow longer, but they can become thicker. This is a skeletal picture of a jawbone in a patient that has acromegaly, and you can see how large the jawbone has grown. So excessive growth hormone can also cause enlarged heart. This is also referred to as cardiomegaly. Left ventricular hypertrophy, which is an enlargement of the left ventricle, and hypertension or high blood pressure. Other signs and symptoms of acromegaly include enlargement of the bones, which can cause joint pain or arthritis, enlarged bony soft tissues of the face and head, which cause changes in appearance, an enlarged tongue, which can contribute to speech difficulties. An enlarged pituitary can cause pressure in the brain. So these patients may have visual disturbances and headaches. So treatment for acromegaly includes surgical removal of the pituitary adenoma, radiation of the adenoma to reduce the tumor size, and drug therapy. Octreotide or sandostatin reduces hormone levels. This is a drug that can be given sub-Q 3 times per week. Surgical removal of the pituitary will require lifetime replacement therapy of certain hormones. So in the transsphenoidal approach, there is an incision made in the inner aspect of the upper lip and gingiva. The surgeon enters through the floor of the nose and sphenoid sinuses to reach the area in the brain where the pituitary sits. This is called the sella turcica. So here we can see a picture of the sphenoid sinuses and the pituitary, and the nose and the tongue. So if we look at a blow-up of this, we can see the surgeon going through the nose up into the sphenoid sinuses to remove the pituitary adenoma. So preoperatively, before the transsphenoidal surgery, we want to balance out hormone levels with hormonal replacement therapy. We want to provide antibiotic nose drops prophylactically to keep the patient from getting an infection. We want to teach the patient about mouth breathing, and we want to discuss pain control. We also want to instruct the patient to avoid coughing and sneezing so that this will prevent cerebrospinal fluid leak. And it's important to do all this teaching preoperatively so that when the patient comes out of surgery, they know what kinds of things that they need to remember. Post-operatively, we want to be sure and keep the head of bed up 30 degrees, so we avoid pressure on the sella turcica. This can reduce headaches. We also want to monitor the neurostatus of the patient and the pupillary responses. Any clear nose drainage that we find needs to be sent to lab because this can indicate a cerebrospinal fluid leak. And a CSF leak may usually resolve within 72 hours with head elevation and bed rest. So in acromegaly, when we remove the pituitary, we discussed a lifetime replacement of what? Certain hormones. Well, we cannot replace the TSH level, so we will give thyroid hormone replacement therapy with levothyroxine or Synthroid. We are not going to give adrenocorticotropic hormone, but we will give corticosteroids, such as beclomethasone, which is a long-acting corticosteroid. And in a female, we will not give follicle-stimulating hormone, but we will probably need to give estrogen replacement therapy once the pituitary is removed.